Hi everyone, these are anatomy and physiology videos for healthcare students. In this video, we'll be talking through muscle tissues. So muscle tissues are built for contraction. Contraction that occurs voluntarily can only occur through skeletal muscle tissue. Otherwise, cardiac and smooth muscle tissue contract involuntarily. You may also see striations, which is a banding pattern, kind of a striping. You'll see that in two types, but you won't see it in smooth muscle tissue. Skeletal muscle is actually the only multinucleate type that we have. That means there are many nuclei per cell. And some other features you may see are branching patterns in cardiac muscle, as well as intercalated disc. So there's only three kinds of muscle tissue. This one is skeletal muscle. It reminds me of a banded snake because this kind of tissue is made of a long, cylindrical cell. It's like a drinking straw, the same distance up and down. And notice the banding patterns that you can see here. All right, so let's start by looking at the nuclei. One is boxed in here. These cells fuse together as we grow, and they create a really long muscle cell, sometimes called a muscle fiber or a myofiber. So as those cells fuse together, they bring their nuclei, and that creates many nuclei or a multinucleate cell. Also, look for these striation patterns. These light dark banding patterns are critical to identify this one as skeletal muscle tissue. So that light dark banding is something you can explore later when you talk about how muscles contract. That's going to be a key feature that is discussed. So this one works under voluntary control. It can also operate involuntarily in response to a reflex arc pathway. If you've ever jerked your hand back from a hot stove or jerked your foot away from the point of a sharp tack, you have experienced the involuntary movement of skeletal muscle. So it's a reflex that can operate to move those muscles. This skeletal muscle is what's responsible for moving your bones and your skeleton. It also helps you make facial expressions. Key things to remember here, it's our multinucleate tissue, only one in the muscle family, and it has these long cylindrical cells like a drinking straw. This one is cardiac muscle tissue. It contracts involuntarily. It is also autorhythmic, which means it sets its own pace. And of course, it's found in the heart. So it contracts to push blood through the heart. Unfortunately, this one does not heal very well. So it's poor to heal or regenerate. If damaged, it repairs itself through scar tissue. Now, scar tissue is mostly collagen fibers. So let's take a look. A couple of features here to look at. We have a branching pattern, which I've outlined for us. Notice these cells branch. It's due to the nature of the way the heart muscle needs to contract together as a unit. Also, intercalated discs are common in this tissue type. Again, it's about getting the muscle cells to contract together simultaneously as a unit. This picture, they're a little hard to see. They look like these little broken lines between the cells. Sometimes in a cardiac picture, it'll look dark. Sometimes those intercalated discs will appear light. So, be flexible in how you look for those intercalated discs. So look for branching, look for intercalated discs to confirm that you've got cardiac muscle tissue. This one is smooth muscle tissue, and smooth muscle tissue contracts involuntarily, just like cardiac, but this one heals easily and heals well. So if damaged or cut, it can repair itself. This tissue is found in the walls of our hollow organs, such as walls of our digestive system, urinary and reproductive system. So it contracts rhythmically through peristalsis to move whatever it is along, whether it's food, urine, blood. These movements involve rings or layers of smooth muscle tissue. Here you've got one nucleus per cell, and there are no striations. So no banding patterns here in this one. Let's go back to cardiac for just a moment. So in cardiac muscle tissue, you can kind of see a little bit of a banding pattern here, but it's not as pronounced as what you saw in, say, skeletal muscle tissue. But here in smooth muscle, there is no banding pattern, no striations. I would go ahead and pause the video, see if you can figure out how to organize these 12 features. Something that goes for cardiac, you'll put just in this green portion of the circle, or for skeletal, you'll put just over here, or for smooth, just on its side. If there's a feature that goes for both smooth and cardiac, put it in the space where it overlaps. Or if all three cells or tissue types have it, put it where all three overlap. So go ahead and work through this Venn diagram, and then we'll do the answers. All right, so striations are found in two of these tissues. Which two? Cardiac and skeletal. Intercalated discs are only found in cardiac muscle. The only tissue here to lack striations, that is smooth muscle. Only one tissue here is found in the heart, and that is cardiac. Likewise, only one tissue here contracts voluntarily, and that is skeletal. Skeletal muscle is also multinucleate, while smooth muscle is described as having spindle-shaped cells. What spindle-shaped means is wide in the middles and it tapers down on either end. We see branching in cardiac muscle cells. Now, which two types contract involuntarily? Well, cardiac and smooth always contract involuntarily. Skeletal can do so when it's a reflex arc pathway. So I put the involuntary under the two that do it all the time. Uninucleate, again, that's cardiac and smooth. That means one nucleus per cell. Skeletal muscle is attached to bones, and smooth muscle forms the walls of our hollow organs. All right, so we have three kinds of muscle tissue: cardiac, smooth, and skeletal. What type is shown here? This one is smooth, and going through my checklist, I don't see striations. I don't see branching, no intercalated discs. It doesn't appear that these cells are multinucleate. So each question I'm asking, I keep eliminating cardiac and skeletal muscle. I do encourage you to look at things like very similar tissue types. If you're going in order from epithelial to connective to muscle to nervous tissues, lay side by side tissues that you think will be confusing and might trip you up on a quiz or a test. For instance, on the left here, we are looking at dense regular connective tissue, and on the right, this one is smooth muscle. So keep in mind, collagen fibers form that dense regular connective tissue on the left, whereas those are smooth muscle cells on the right, and those are their own nuclei. On the left, those darkened spots, they're fibroblast nuclei. Also, just a reminder to not memorize any tissue type by their stain color, because those stain colors may change from picture to picture. Rather, I would look at the pattern and pattern match. Best of luck learning your tissues. If you have any questions, you're welcome to leave them in the comments. If you like this video, please follow my channel. Thanks for watching.